Now we are going to discuss instruments, tubes and catheters. This section is very important, especially for final year students, because it is frequently asked in Viva, and it is very important for DNB and NEET exam, because you have seen at least one question is asked from this segment in the latest pattern of exams. So we are going to discuss instruments first. Now have a look, what are the parts of instrument? So you can see in this instrument there is tip, there is blade. What is the other name of blade? That's known as jaw also. This is the joint, it is also known as box lock, joint also known as box lock. This is shaft, also known as shank. This is ratchet, which is also known as catch, and this is finger bows. These are the parts of instrument. Now you can see in the jaw or blade, this jaw or blade is the working end. This is the working end of the instrument. In certain instruments like Ellis tissue forceps, can you see here? In this you can see that there is presence of teeth. And what are these teeth? Nothing. There are prongs at the end of jaw or blade. So these are various prongs at end, which is also known as teeth. What is the role? It helps in firm grasping of tissue. So this teeth, it helps in firm grasping. Now can you see this is ratchet? What is the function of ratchet? This is the interlocking part of instrument. So this ratchet is also known as interlocking part of instrument. And here you can see this is finger bows. What is the function? It controls the jaw movement of instrument. So these finger bows, these are going to control the jaw movement of instrument. Now you can see in the jaw or blade, here you can see in this region, in the jaw or blade there are serrations. In the jaw or blade there are serrations. These serrations can be like this. This is known as transverse serrations. It can be like this. These are longitudinal serrations, or it can be something like this. Cross-hatched serrations. Now you must be knowing that this kind of transverse serrations are seen in artery forceps. This kind of longitudinal serrations are seen in intestinal clamp, both crushing as well as non-crushing, and these kind of cross-hatched serrations are present in needle holder. Now you can have a look of this instrument. In this instrument, can you see this is the tip, this part is tip, this is the jaw or blade, this is actually a needle holder, and you can see cross-hatched serrations and there is a groove. This is the box lock or joint. This part is shaft or the shank. These are finger bows, and can you see this is the interlocking part. What? This is the ratchet. This is the ratchet. So these are the parts of instrument. We will keep on repeating these words when we will discuss individual instruments one by one. The instruments can be non-traumatic or traumatic. Non-traumatic instruments are not having any kind of biting or crushing effect, but traumatic instruments are having biting or crushing effect on the tissues. How to differentiate? Usually in non-traumatic instruments, the serrations are very fine, whereas in the traumatic instruments, either there is a tooth or there is deep serrations. There is deep serrations which leads to crushing of the instrument. Instruments can be non-traumatic or atraumatic or traumatic. So what are atraumatic or non-traumatic instruments? These instruments are not having any biting or crushing effect on the tissues, whereas traumatic instruments are having penetrating or crushing effect on the tissues. Usually in atraumatic instrument there is fine serrations, whereas in the traumatic instrument either there is a tooth which or there are deep serrations which leads to crushing of the tissues. Now individually one by one we are going to discuss the various types of instruments. First of all, we are going to discuss the towel clip. So you can see this is a towel clip. In this case you can make out that blades are curved. There are curved blades and there is a pointed tip. So blades are curved and pointed. So you can see with the help of this curved blade and pointed blade what it can accommodate the drapes. What is the function of towel clip? It is basically used for draping. What do you mean by draping? Draping means isolating the surgical field. You have seen various surgeries. In those surgeries what we do first, suppose it's abdominal surgery, we have to clean the patient first from nipple to mid-thigh. After cleaning the patient from nipple to mid-thigh, we have to isolate the part of surgery with the help of towels. Now can you see? I am going to isolate this abdomen with the help of towels. And these towels are fixed, or these drapes are fixed with the help of towel clips. What are the other functions? There is attachment of diathermy cables, suction, cautery. So what are the uses of towel clip? It is used to fix the drapes. It is used to fix suction tubes, catheters, diathermy wires, cables to the OT table. There are three types of towel clip. This is first one and this is known as Mayo's towel clip. This is known as Mayo's towel clip. There is another towel clip which is having pinch cock action and that is known as Doyne's towel clip. Now you can see this is Doyne's towel clip. The function is almost same like Mayo's towel clip. What is the additional thing here? In this case there is pinch cock action, and in the Mayo's towel clip there was a ratchet. The third towel clip which is asked in exam, so this is Moynihan's tetra towel clip. It is Moynihan's tetra towel clip. Why it is known as tetra towel clip? Because you can see that there are two teeth in each blade. So there are two teeth in each blade. That's why it's known as Moynihan's tetra towel clip. What is the additional function of this Moynihan's tetra towel clip? You can see that there are two teeth, and because of this we can hold the cut edges of skin. Cut edges of skin to the four corners of draped towels. To the four corners of draped towels. So with the help of this instrument, Moynihan's tetra towel clip, I can hold the cut edges of skin to the four corners of draped towels to isolate the surgical field. So these are three types of towel clips which are mainly used in draping and fixing diathermy wires, cables, suction, laparoscopic cables to the OT table. So this is one of the commonly asked instrument and commonly used instrument. What's the name? It's the Ramplace. It's the Ramplace sponge holding forceps. Now you can see in this, can you see the tip? This is the tip of blade, And if you see the shape of tip of blade, this is oval in shape. It is oval. And you can see here that there is presence of serrations on the, you can see on the inner aspect. On the inner aspect of the instrument, there is presence of serrations for firmly grasping the sponge. And you can see what? That there is fenestration. So what is the role of this fenestration? So that the gauze piece or the swab can bulge out of this fenestration. Now you can see this instrument is having long, there is long blade as well as long shaft. So why this instrument is having long shaft and long blade? So that scrubbed surgeon can clean the operative field without touching the rest of the areas. What are the various functions? It is known as Rampley's sponge holding forceps. So first, it is used to hold the sponge which is dipped in antiseptic solution for cleaning the patient in most of the surgeries. What are the other functions? You have seen that during open cholecystectomy, we can hold the fundus or Hartmann's pouch of gallbladder. And in hydatid cyst, what's the function? It is used to remove the laminated membrane and the daughter cyst. What else? Sometimes in abscess, we have to insert the gauze piece and we can swab that abscess cavity with the help of this Rampley's sponge holding forceps. So see the functions or the various uses. First, it is used for cleaning in most of the surgeries. Second, in open cholecystectomy to hold fundus, and Hartmann's pouch of gallbladder. Hartmann's pouch of gallbladder. It is also used to swab an abscess cavity, and it is used to remove laminated membrane and daughter cyst. Laminated membrane and daughter cyst. In hydatid surgery, in hydatid cyst surgery, this is BP handle and these are the blades used with BP handle. So this is barred Parker handle, and these are the blades used. Now in this instrument, can you see there are transverse serrations. There are presence of transverse serrations in the handle, and these transverse serrations in the handle helps in better grip of BP handle. Now you can see the one end of instrument is narrower, and you can see that there is presence of slot. So these blades are used at this slot. Now lots of questions are asked that which number of blade should be which particular surgery. So have a look. This blade, which is 10, this is used to open skin. This is 11. This is used for arteriotomy. During vascular surgeries, this 11 number is used for arteriotomy during vascular surgery. This 15 number is used for minor surgical procedures. Minor surgical procedures. It is also used in plastic and pediatric surgery. Used in plastic and pediatric surgery. So in which cases we are using this 22 number? This 22 number of blade is used for abdominal incision. Abdominal incision. And this 23, this is used for very thick skin. it is used for very thick skin. So these are the uses of these various numbers of blade. Now BP handle with blade is used for giving the incisions. Questions are asked that what are the various methods of holding the BP handle? Various methods of holding the BP handle with the blade. So see, there are three positions. First of all, there is dinner knife position. Generally, this position is used for making an incision to avoid tailing at the end. What is the second position? Second position is writing position. Writing position means the way you are holding a pen. In this particular position, you have better control over the knife or this BP handle with blade. And third position, which is used for amputation, and that is known as grasping position. Grasping position, and this grasping position is mainly used for amputation. So this dinner knife position is used for making an incision to avoid tailing at the end. Writing position gives us the better control at the instrument, whereas grasping position is used for amputation. This is the needle holder. Now can you see how you are going to identify this needle holder easily? In its blade, it is having this kind of serrations. Can you see? This kind of serrations are there. These are known as crisscross serrations. So question, why there is crisscross serrations in the needle holder? It helps in better grip on the needle. So there is better grip of the needle with the help of this crisscross serrations. Needle is not going to move. Second thing, can you see, in this there is presence of central groove. Because of this central groove, there is minimal crushing effect on the needle, and there is no straightening of a curved needle with the help of this central groove. Questions are asked that what is the handle to blade ratio? In the needle holder, the handle to blade ratio is 4:1. It is 4:1. Second question is asked, where to hold the needle? With the help of needle holder? Now can you see? If this is a suture and this is the needle, the part of needle which is attached to the suture is known as swaged end, and this is the pointed end. Swaged end and pointed end. This is also known as, the pointed end is also known as anterior part, and this is known as posterior part. So what is the point where we are going to hold it? At the junction of anterior 2/3 and posterior 1/3. So we are going to hold the needle at the junction of anterior 2/3 or posterior 1/3, or 2/3 from pointed end, 1/3 from swaged end. So how we are going to hold the needle with needle holder? Have a look. Now can you see, this is a needle holder and this is having crisscross serrations with central groove. This is a needle. So I am going to hold this needle at the junction of anterior 2/3 and posterior 1/3. Anterior 2/3 and posterior 1/3. Clear? So this is how we are going to hold the needle with the help of needle holder. In exam, sometimes examiner will ask you that hold the needle with needle holder, and this is the way you are supposed to hold it. So what are the uses of needle holder? The uses are suturing, suturing of tissues and ligation. With the help of needle holder, we are going to ligate the vessels also. So, for suturing of tissues and ligation. This is Doyne's rib respiratory or Doyne's costal elevator. So, this is Doyne's rib respiratory, also known as costal elevator. Now, how to identify this instrument? You can see in this instrument that there is polygonal handle. What is the use of this polygonal handle? This is for better grip. For better grip, there is polygonal handle. Now you can see these blades are going to end. These blades are going to end in curved fashion. These are going to end in curved fashion, and simultaneously you can see the edges of the blade. Can you see the edges? Edges of the blade are very sharp. So why there are sharp edges of the blade? To separate the periosteum from the undersurface of rib. There is sharp edges to separate the periosteum from undersurface of rib, and that's why it's known as rib respiratory or costal elevator. Question is asked that how to determine the side of rib respiratory, whether it is of right side or it is of left side. It's very easy to determine the side. Can you see? In this first one you can see that the handle faces laterally. The handle faces laterally, and if you can see the hook, the convexity of hook is upwards. Convexity of hook is upwards, and the tip should face downwards, away from the surgeon. Tip should face downwards and away from the surgeon. So can you see this first one, it is for right side and this is for left side. So how we can determine the side? The handle should face laterally, the hook should be facing having convexity upwards, and the tip should face downwards and away from the surgeon. So this is how we can determine the side. Questions are asked that what are the uses of respiratory? It is used to separate periosteum from under surface of rib. Separate periosteum from under surface of ribs. So this is Cocker's thyroid dissector. What is the use of Cocker's thyroid dissector? It is used to dissect the superior thyroid pedicle during thyroid surgery. Cocker's thyroid dissector. So it is used to dissect superior thyroid pedicle, superior thyroid pedicle during thyroid surgery. So this Cocker's thyroid dissector is used to dissect superior thyroid pedicle during thyroid surgery. This is aneurysm needle, and what is the function or use of aneurysm needle? This is aneurysm needle, and what is the use of this aneurysm needle? Aneurysm needle. The use is, it is used during venesection to pass ligature around the vein. So it is used during venesection to pass ligature around vein. To pass ligature around vein. Aneurysm needle is used during venesection to pass ligature around the vein. This question was asked in a latest exam. What's the name of this knife? This is known as Humbee's knife. And what is the use of this Humbee's knife? It is used for harvesting partial thickness and full thickness skin graft. So it is used for harvesting split thickness skin graft and full thickness skin graft. Split thickness skin graft and full thickness skin graft. We can calibrate the thickness of graft being harvested with the help of this instrument. So this is Humbee's knife. This is rib shear or rib cutter. Rib shear or rib cutter. So obviously it is used for cutting the ribs. Now simple question, what are the parts? In this case, can you see there is a parietal part or parietal part of blade, and there is visceral blade. There is parietal blade and there is visceral blade. Here you can see the visceral blade is blunt. Visceral blade is blunt, whereas parietal blade is sharp. So there is only one cutting end. How to differentiate this instrument with bone cutter? In the bone cutter, both ends are sharp. Have a look. The question is asked, how to differentiate rib shear or rib cutter from bone cutter? Can you see? I told you that this is parietal part of blade or parietal blade, and this is visceral blade. In this case, only parietal part of blade is sharp. So there is only one cutting end. Whereas in this bone cutter, can you see both ends? These both ends are sharp. So both ends are sharp. This is how we can easily differentiate rib cutter or rib shear from bone cutter. And what is the use of rib cutter? It is used for cutting the ribs. This is Kelly's rectal speculum, also known as proctoscope. Kelly's rectal speculum, also known as proctoscope. Now simple question, what are the parts of proctoscope? You can see this is the outer sheath which is hollow. So this is outer sheath, and in this you can see there is handle. So there is hollow outer sheath with handle, and there is inner rod. Can you see this one? This is inner rod, and this inner rod is known as obturator. In this obturator, you can see the end of this obturator is smooth and rounded. It's smooth and rounded. This question was asked many times in exam, that what's the length of proctoscope? See, the length of various instruments. Length of proctoscope is 10 centimeter. Rigid sigmoidoscope 25 centimeter. Flexible sigmoidoscope is 60 centimeter, and length of colonoscope is 160 centimeter. This question is frequently asked. This question is frequently asked. So what are the various uses of proctoscope? Length is 10 centimeter. So within 10 centimeter of anal verge, whatever is the pathology, in most of the cases we can make the diagnosis. Sometimes it's also used for therapeutic purpose. So there are uses both diagnostic and therapeutic. So have a look of uses of proctoscope or Kelly's rectal speculum. First, what are the diagnostic uses? It is used for diagnosis of hemorrhoids. I told you one simple question, that hemorrhoids are not palpable during digital rectal examination. Hemorrhoids are not palpable during digital rectal examination, and that's why what's the investigation of choice for diagnosis? It's the proctoscopy. Other indications are rectal polyp, rectal ulcer. For diagnosis of carcinoma anal canal and lower part of rectum, carcinoma anal canal and lower part of rectum. It also helps in localizing internal opening of fistula in ano. Fistula in ano. Now how to understand this is very easy. Can you see what is the length of surgical anal canal? The length of surgical anal canal is 3 centimeter. And how much is the length of rectum? Length of rectum is 14 centimeter. Length of proctoscope is 10 centimeter. So whatever is the pathology within this 10 centimeter, this 10 centimeter, in most of the cases we are going to make the diagnosis like hemorrhoids, rectal polyp, ulcer, carcinoma anal canal, lower part of CA rectum, and localizing the internal opening of fistula in ano. What are the therapeutic uses you have seen in OPD? Therapeutic uses. So main use, you have seen that it is used during sclerotherapy and banding of hemorrhoid. Very important. Used in sclerotherapy and banding of hemorrhoid. It is used for polypectomy and also used for anal dilatations. Anal dilatations. So these are various diagnostic and therapeutic uses of Kelly's rectal speculum.